Recording in progress.
तो शायद आवाज के लिए खाने के लिए पैर की चोट जो थी तो उस सिलसिले में उसने ये उनको पर्चा दिया। उसने वो कहा है कि इसके लिए वो करो, क्या नाम, रेजिडेंसी के लिए अप्लाई करो। तो इसलिए तुम उनसे देख के बात कर लेना, खबर भाई से। खबर भाई के और इनका जो है ना बेटी का घर, इनका घर खबर भाई का जो कारपेंटर बिल्डिंग।
Yeah, so like, should we begin with a new question? Like, can we start with the advancements in the healthcare in the future? Hello.
Yeah, we can start.
So somebody wants to speak on that. Like, should we, like, somebody wants to voluntarily speak on that question? Yes, Sunil, you want to speak? You can please go ahead. So anybody else wants to speak, like voluntarily wants to speak, you just raise your hand or you can just switch on your mic.
I can go ahead.
Yeah, please go ahead.
Hi. So I think for advancement of healthcare in the future, technology will play a huge role. As we can see with artificial intelligence coming up hugely in medicine, I think that has huge scope. Recently, we have been seeing how, because of the COVID pandemic, telemedicine has been playing a major role in delivering healthcare to, especially to the vulnerable populations who might not be able to access healthcare. In such cases, digital stethoscopes, which are being implemented in increasingly, and other methods for contactless medicine will have a huge impact on our society. Along with that, with the increasing scope of artificial intelligence, it will decrease the workload on doctors, I feel, and will help doctors deliver better patient care with decreasing clerical from listening to the cough of the patient. So I think apps like this, which are very innovative, will increasingly be implemented and will greatly improve our healthcare system.
That's a very, very good answer. Yeah, you actually covered all the points that I had in my mind for the answer to this question. So yeah, anybody else?
Thank you for the feedback.
Anybody else want to speak on this question? You can even, it's not necessary to turn on your cameras, you can just speak, like turn on your mics and speak, like that's fine. So, or otherwise I'll just answer like what I have prepared. So yeah, so that's a very interesting. So should I go with the answer? Okay, like nobody wants to answer, so I just answer. So yeah, firstly, the advent of the AI and its incorporation into healthcare will definitely reduce the human errors. Secondly, is to reduce the cost of healthcare everywhere. Like for example, in my country, the a lady by the name of Indran Mukherjee and her company are trying to prepare insulin at a cost that is that are preparing insulin at a cost less than 10 cents and make it accessible to everywhere to everyone, since India is the diabetic capital of the world. Thirdly, I want to. I just had these 2 points, and yeah, thirdly, I will talk about the telehealth. The advancement as a post-COVID, the especially even during my clinical rotation in the US, I saw the importance of importance of telehealth, and plus in India also the government of India has taken an initiative by the name of Sanjeevani, by which they are providing telehealth to people even in the remote areas and make healthcare very accessible. So yeah, these are my so I think that's how the healthcare is going to progress in the coming years.
Ayushman, if you don't mind, can you once repeat it again? the first 2 points
Okay. The first one
very
is like,
briefly.
yeah, as Debonina mentioned, like the advent of the AI and its incorporation into the healthcare system will definitely reduce the chances of the human errors. Secondly, is the efforts have been taken by across the globe to reduce the cost of healthcare. The prime example is the lady Indrani Mukherjee. I just have to confirm that. I think she's the CEO of PepsiCo. So she's taking the measures, she's taking the initiative to produce insulin less than 10 cents and make it accessible to everybody. Thirdly, is the telehealth post-COVID. It is becoming more and more. It is becoming more and more prevalent in the healthcare practice. Like for example, during my rotations in the US, so like I in the clinic at New York and in Michigan, I could see even I participated in televisits. Back in country, the initiative Sanjeevani by the government of India and government of India is making healthcare accessible to more and more people in the rural areas. Plus, people who never had access to the imaging services can get it done sitting in the remote areas, and the reports can be done somewhere where all the facilities are, where the doctor remoting can be done at a different place. So yeah, these are the 3-4 points that I would like to mention.
Thank you so much, Ayushman.
But I think Debolina had very good points. So yeah, they have to be taken into consideration. Anybody else wants to answer or add?
I think I can add one more point. Usage of nanorobots in surgeries like onco surgeries.
Yeah. So you can just frame your answer, Dr. V. Just frame your answer.
I haven't framed my answer yet, but I can add this point to that what you have told.
Yeah. That's a good nano surgeries coming up.
That's a Zoom meeting, like a couple of people. Okay,
yeah, somebody else wants to answer this question?
I have a question. You mentioned about the robots like coming, like machines taking up a little bit of work. And second, you said after the COVID, the new opportunities opening in the telehealth. And third point, you said, can you please tell me again? I didn't understand the headline.
Something about insulin? You told something about insulin, right?
So basically, like in US, when I was at a clinic in Michigan.
I'm sorry to interrupt you, Ayushman, but your voice is so low today.
My voice is low. How come?
Yeah.
I have to fix it.
He has to come near the mic or something. Yeah.
Or I just attach my phone to the mobile. Just give me a second. Yeah, I just accidentally left the meeting. I'm sorry about that. Yeah, now I'm audible. Hello. I just added mic to my computer.
Yeah, now you're okay.
It's definitely better.
Yeah. So yeah, like anybody wants to talk about this question, or you want to add anything? Like, or you can just frame or you can just answer like you're going to do in the interview. Like even it's fine. Even I didn't prepare a draft. That's what I had few points. But
no, I have a quick question. Because now voice is very audible and nice. So you were saying about the that 10-cent thing. What was that?
I was talking about the telehealth.
No, 10 cents, like something medicines became.
So basically, I just saw an interview by, I think it was Indrani Mukherjee. I don't know, I have to confirm her name. And she's some CEO of, I think, PepsiCo. So she's planning to, produce insulin at, I think, 7 rupees. So that actually amounts to less than 10 cents.
Okay. So you mean to say nowadays medicines have become more accessible and cheaper as compared?
They might become cheaper over a period of time.
All right.
So can you repeat your second point, Nikhil Dubal? Yeah, Nikhil, you're talking about whom? Like, you want Debulina to repeat her second point, or me, or somebody else? Okay. So somebody wants to answer this question, add anything to it, please go ahead. Feel free to answer. Like if you want even add few points, you can do that.
So I have a question. So you said something about the insulin prices becoming cheaper, right?
Yeah.
So like how is it directly related to like advancement in technology? Like, could you elaborate on that part?
Like for me, I can just say that efforts have been taken by different countries to reduce the cost of healthcare. And that I can just quote it with the example. Like that's what just came to my mind. I definitely have to do more research about this. But yeah, that's what I heard. Like I think her interview with Indrani Mukherjee with Barkha, that's few years back. So I just heard, that's why I quoted the example. But yeah, I would just, my point is that efforts are being taken to reduce the cost of healthcare.
I think in this case, we can talk about using computational aspects, by which we can reduce the amount of lab work needed to bring medicines to the clinics, and much of the work is done in programming languages, so
Yeah.
thus decreasing the costs.
Yeah.
Yeah, I have one more point to add. Besides those 3 points, one more, guys, like digitalization. Digitalization has brought enormous benefits to healthcare system, more accessible, more easy, like at home, a patient can get, all the information at home. He doesn't have to travel, especially the elderly population. So with this global, this improvement, and I think that it will go a long way. So digitalization is one of the points.
That's a very good point.
Hello, everyone.
Hi.
My name is Sarah Khan, and I would just like to hop on what Ino just said, that digitalization. I think it's a very strong point, because by digitalization we can make lesser errors, like implementing EMR, right? Like Epic and stuff. We make less errors, and less errors means lesser burden, lesser things to rectify. So I think that's a very good point.
That's a good point, Indu. Thank you so much. But yeah, Indu, even I had this point in my mind, and we can just, like add like how during COVID, like our government of India had a digital platform where they could register everybody who got vaccinated, and that's how they could have a very large coverage of population getting vaccinated. So preparing more database so that a lot of information can be saved, and it will help. It will increase the efficiency of the healthcare.
Exactly, the data thing. They also facilitate the, collection of individual health information in different settings, by the way, and the rapid and accurate transfer, as what Sarah said, accurate transfer of information between patients and healthcare professionals.
Yeah. So anybody else wants to, like, if you have prepared your answer or you have anything in your mind, you can just speak out.
Yeah, of course.
Like we can also say about the there's a availability to monitor patients remotely, and some wearable devices, for example, that easily can monitor vital signs and glucose levels, and it will decrease the hypoglycemia levels. So it's still technology, and it's very well known, right? And the diabetic patients don't have to do like daily pricks to analyze their glucose levels. That's it's very comfy, and it's widely used in US now.
Can I add one more thing? I don't know if it is a recent advancement or not, but I have heard the term like broncho ultrasonography, which is useful for ultrasonograph of a heart. I don't know if it is a recent advancement or not. I don't know the entire thing, but I have heard this line called broncho ultrasonography, useful for like ultrasonograph of heart from bronchi region, like bronchioles region. Something like TEE, but more advanced than TEE.
Even like availability of getting the dialysis done at home. Like I think recently in Shark Tank season 1, somebody came with the idea to get dialysis, this dialysis being done at home, so people don't have to visit dialysis center. So that can be even a good example. Like you can add to it. Digital health solution include broad categories such as mobile health. Yeah,
But isn't that like that's an option? People do get dialysis at home already.
yeah.
It's something which has been implemented like decades ago.
That's a peritoneal dialysis to get at home, but I think you
Yes.
can get the other one at home. But yeah, it's just a point. Like you can just use it. I know it. Otherwise, there are many other good points to mention. You can
Yeah,
just
yeah.
ignore it.
Yeah, because like I just don't want us to be in a position where like we have foot in mouth and the program director will be like, oh, you know, we already do that. You know, it's not like a. So that's why I just like brought it out.
Can we have delivery of medicines to home as a
Sorry?
recent advancement? Something like delivery of groceries to home is there, right? So delivery of medicines to home.
That has been implemented a long time ago as well. Like, you know, CVS, Walgreens, they normally send out medicines at home. They deliver. They have that option.
Okay. Thank you.
Of course.
I have a question. How can we answer if they ask what is the disadvantage of AI in the healthcare system? How could we answer that question?
Yeah, that is a tough one.
Yeah, like usage of Quillbot, AI, ChatGPT, everything else in the usage of medicine. How do we answer that question? Do we have any other, like anybody can answer this question, guys?
I just have one point in my mind. That's what I heard from my other people, that AI will definitely take the jobs of radiologists and make the imaging like they definitely it will start get incorporated into the radiology things and will do the reporting on its own. So definitely the job of these radiologists will reduce with time. Do I have to research about that? But yeah, that's what I heard.
Ayushman, I'm sorry to interrupt you once again, but your voice is still low.
My voice is low. How come? That's a shock.
All right. In the meantime, you fix your voice. I have something about this question.
Sure,
So
go ahead.
guys, obviously AI, artificial intelligence, it's artificial, not human. So lack of what? Lack of creativity will be there. And then, so AI, so that which lacks the human ability to use emotions and creativity in decision making, right? So that will have its own set of disadvantages in near future, and maybe lack of satisfaction will emerge out of it. That's what I'm thinking right now.
Yeah, that's a very good point. Also, we can add that at this moment, artificial intelligence, like ChatGPT and everything, these are very unregulated, and the information they provide may be outdated or not scientifically accurate. So, if patients start depending on that, then that will cause spread of misinformation. So that is maybe one of the disadvantages as well.
That's a good point.
Yeah.
Anybody else wants to add something to that, or even how the healthcare will change in coming years, or how AI will affect the healthcare?
Yeah, nowadays patients have been using this Google and everything like ChatGPT and all, interpreting their diagnosis as larger things. If, for example, a patient has got cough and fever, they're thinking it as like tuberculosis or some lung cancer, and coming to the doctors, irritating them, and they are making us panic, and they are getting into the panic attacks.
Yeah. Yes. Yeah.
Yeah, one more point. Definitely, what is AI? When we do ChatGPT, what it does, it collects all the information available over the internet or whatever. So, okay, so what is it doing? It is collecting the data, but it doesn't have its own creativity like human brain has. So it loss of creativity. And second, if it will take over the job of many humans, so unemployment will increase, right? And definitely no ethics involved in this, no emotions involved in this. all these. Yeah.
Yeah, that's a good point.
Yeah.
But somebody when asked you like the AI in the healthcare, how it's going to affect the future. So we have to just talk about the both positive and the negative aspects. So like,
No. Somebody asked the disadvantages. That was the answer for disadvantage. If we ask what are the how it can influence means both advantage and disadvantage. Then the question changes.
then we can like Siddhant, yeah, Siddhant in the chat mentioned that when if you have to talk about the influence and positive influence, we can definitely add it helps us to give ease with the symptom presented. Plus, it will help to reduce the shortage of the doctors and make healthcare accessible to everyone. That can be the two positive aspects of AI, and it can reduce the human errors. So yeah, like 2-3 points we have, like the for positive and negative, like Indu mentioned, lack of empathy, lack of creativity, and it will take away the jobs as well.
Hey, Ayushman.
Yeah, please go ahead, please.
I had one thing to say, but I don't think that AI removes creativity. I mean, has creativity of its own also. Although there won't be a human touch involved, but AI is creative. We can't say that it lacks creativity. I
No,
mean,
Ishan, I mean to say, yeah, AI doesn't have thinking capacity like humans. What AI does, it collects the data of whatever available on internet. That's
bro,
the job of
that's just the current chat GPT, right? There are a lot of AIs, and you know that AI has written a research paper recently as the first author in 2022 or 2021. I don't know. I heard it in St. Peter's. Ayushman must be knowing. You must have heard about the conference, right? Oh, do you remember? Oh, do you remember me? Okay, but yeah, there was a conference there, but yeah, AI was the first author. This happened for the first time in 2022 for a research paper. So we can't say that it is not creative. But yeah, there is no human touch. Yeah.
Okay. Just before continuing, Ishan, you're the one I'm in Michigan.
Yep.
Oh, great.
How many Ishans do you know?
I know many of them, so let's not go into that.
Okay.
Right.
Sorry.
Yeah. So,
Yeah,
Ishan,
please
like, do
continue.
you want to add anything? Like, do you want to answer this question? Like, how advancements in the healthcare will be made in the future, or something like that? Go ahead, buddy.
Yeah, this point, the research thing that AI was the first author for the first time for a research paper. I mean, I don't have the specifics about it, but you can Google it. Yeah. You will have to do some research on it. Yeah. Thank you.
So, yeah, should we go ahead with the next question?
Yeah.
Sure.
Anybody else wants to add something to it? Please go ahead. Or you just want to answer. If you have prepared the answer, please you can say it. Like even the points are repeated, that's fine. It's a practice session.
Well, I want to agree with one of the speakers. I believe it was Indu, or no, I don't think so. She was recently speaking about the AI creativity for Aisha. So what I think we can use that sentence in the matter of that whenever there is a diverse patient, right, it can be more error prone because it may lack some cultural sensitivity, or the case can be complex, and it cannot interpret the right diagnosis and easily miss out some stuff. So it will have some limited adaptability. So we can choose that one as well.
Yeah, this is a very good point, right? In terms of diversity, AI won't be able to distinguish.
Yeah.
And I want to add some one comment that AI don't not going to be spontaneous. It will give you the information that people feed in, and only based on this, it will give us the information. But I believe that it will not be going to spontaneous as a human.
Yeah.
Yeah, I'm sorry to interrupt, but I just wanted to ask. So the question right now, is it like the current advancements or like the future?
So, like, if somebody asks you the advancement in the healthcare, something happening in US, it is not
Okay.
it is not being implemented in the rest of the world, right? If something happens, different thing happens in India, it's not being implemented everywhere. So we can even talk about that how countries are taking initiatives to improve their healthcare, and that can, different countries can learn from that. Like that's what I feel. I'll answer my question. Baki, you can add your own points. Should we move to the next question, or somebody wants to add to this?
Sure, we can move on, I think.
Yeah, like, can we just move to the question, the difference between your home country healthcare and the US healthcare?
Can you repeat the question once again?
The difference between your home country healthcare and the US healthcare system?
Okay. I think we have mentioned this in one of our meetings, right?
We just talked about the US healthcare or why the home country experiences. But what's the difference? We didn't talk about that.
So basically, we don't use this EMR system in our country, whereas US use it.
Okay.
And nowadays it's a recent advancement in India, like telemedicine, whereas it has been going on for decades in US.
Okay.
We basically use this THAIs, ANMs, which is not there in US.
Okay.
And what there else?
I'd like to add a point over here that back home what we do is we had I'm originally from India. So back home what we do is we as you mentioned that EMR is not prevalent, but there are a lot of hospitals who do maintain EMR, even though like we use case sheets for with written documentation for everything. There is a department that is called MRD in India. That is the medical records department. So they have electronically, saved all the medical information. Like they have huge databases. So I don't know how far it's prevalent, but I have very commonly seen it. I'm from Hyderabad, so I have very commonly seen it in my city, but I don't know how it is prevalent in other parts of India. So yes,
I think
we have.
all of us have. I'm sorry. Yeah, I think all of
Go
us
ahead, go
have the
ahead.
MRD department in our
Yeah, yeah.
colleges. Yeah.
Exactly. Because like we here in US, we use EMR, the electronic medical record system, right? The name is different. Back home we have MRD.
But yeah, Dr. K, like there's a difference in the digitalization. Like in an EMR, you can just add a click, you can get past information of the patient, and it makes the getting the past information very accessible. But MRD is, yeah, it is definitely something. It can be a point of difference that we have a database in the form of MRD, and US it's digitalization. And talking about the EMR, I worked in Narayana for like 6 months in Katra. So they do have their EMR. So big corporate hospitals do have, and few of the government setups even have the EMR, but it's not widespread over here. So that can be a point of difference between here and the US.
Right, I agree.
And like 2 points Dr. V mentioned about like one is the EMR system, the other one we can talk about like, can you please elaborate your points again?
One more is telemedicine, which has come recently during COVID time in India, which we haven't used previously. And one more thing, we have been using this ANMs, ASHA workers, DHAIs, going to coastal areas, rural areas or hilly areas, which we can't go at present, and work using them, which is not there in USA.
That's the good points. Yeah. Yes.
We can talk about the volume of patients. Most of us are in underdeveloped or developing countries, so we have a huge volume of patients, right? Compared to the United States. It's easier. I mean, it's easier there. They just add 10 a day, I think, approximately. So one more thing I'd like to add is, I'm sorry.
Yeah, definitely the time we give in India is less, compared to what time we give in US. That's a very solid point. Like the number of patients and the wide pathologies we see in America, in India, but yeah, because of the population. Yeah, that's a good point. That's a solid point.
Yeah, we can
And
also
one
talk
more
about.
thing is we
Sorry.
use practice-based medicine rather than going for research or evidence-based medicine, which is there in USA, like research-based medicine.
Yeah.
Overlapping of answers.
Yeah, Ishan, could you please complete your point? Like the second point you were
No,
talking
no,
about.
I'm sorry. I was listening to the practice medicine. Can you tell me what the difference is?
You want me to explain once again, Ishan?
Yeah, I mean, in short, if you could,
Like
please.
we usually go with we don't usually go with research type of medicine, right? We are going with like, yeah, come to the hospital, treat the patients, and go back to the home. We don't use research and everything within the hospitals. Mostly, like at present, we don't use research, but whereas in the most of the hospitals in the US usually go with the research type of practice to
Okay.
research to advancements and include that in the patient care.
Yeah,
Dr.
correct.
V
But
N.
I mean, sorry.
Yeah. So
I
what
had a
difference are
doubt.
you?
I'm sorry. Sorry. Please
That's okay.
continue.
The same question to VN. So what you are trying to imply that, okay, in India we have practice-based. So what difference you are trying to convey us? Like what difference does it make then, according to you in brief?
Yeah. It's like traditional type of medicine rather than including our researchers going on in the world in the medicine, isn't it?
Okay.
Hi, I feel it will
So,
be, I don't
do you
think
mean
it
it's
will be,
inferior to research-based medicine, research-based medicine practice? So, if the program director asks us directly, like, what do you mean by practice-based medicine? And so, like, saying negative about our own country.
I'm not going to like elaborate my answer regarding this because it is going to be inferior to the India. So that's why I'm
Yeah,
just
I
putting
know.
the question as like, yeah, just
That's why I was
practice-based
thinking that should we
medicine.
mention this point if they ask us
I
to.
will do that. Like that's a valid point. Like yeah, I would do that for in my answer, but yeah, but I'll research the both terms differently so that if somebody asks me to elaborate, I can just quote the example as well.
Okay. Yeah.
Yeah.
If we get any more better answer, then we can remove this. But at present, I'm just going to add this. If at all, if I get interview right now.
I have one more point. I mean, so in India or developing countries, the distribution of work, like for especially for nurses, they don't have that much of autonomy, I think. And in US, like nurse practitioners, they're allowed to prescribe a lot of medications. This is something different, I think,
Yeah.
from
Even
US.
Dr. RC mentioned in the comments about the multidisciplinary team. That's a very valid point. We can talk
Yeah.
about the multidisciplinary and holistic, approach to healthcare in US, like the involvement of the doctors, nurses, pharmacists, social workers. Then after discharge, even we have nursing homes and old age homes as well. To take take the patient, to take the
నేను రేపు
care of
వెళ్ళి
the patient
చూసుకొచ్చుకుంటాను.
but the same is not in India for sure. It might be in some parts of the India, but not everywhere. But we can just add at the end of the government of India is taking up the measures to do about that. That even Doctor this in the chat box, Doctor like somebody with the name of iPhone talked about like availability of the medicines. Like yesterday, I was listening to a webinar. Basically, I just came up with a question after that only. Somebody was talking that even the apart from the over-the-counter medicines, we have the availability. All of the medicines are easily available in like in India, but it's not in US. So they even talked about that point. And Dr. Prabhin Thapa is telling that the primary care is more organized in US. Yeah, it is. But yeah. Prevention medicine at vaccination screening more in US. Yeah, even yesterday somebody talked about that the screening is more well structured and organized in US. Like they follow the the age appropriate protocols, but it is not widely practiced in India. So So somebody wants to add other points?
Yeah, also somebody mentioned about, I think Dr. Usman mentioned about Medicaid and Medicare in USA, which is not there in India.
But we do have Ayushman Bharat scheme. Like, yeah, we can say that, Medicare in US, but after that, recently the government came up with the Ayushman Bharat scheme to give a coverage up to 2,000 or like 5,000, $3,000-4,000 to all the people below the poverty line. We can talk about this point as well, like definitely.
Yeah.
And somebody, Dr. Brendan, talked about the patient proportion of infections are more common in, yeah, definitely. We have more bacterial infections compared to in US. Yeah, that's a good point. And even insurance, that in US, like most of the people are insured, but not in India. Like, though government is coming up with the measures, but still people are not getting insured. Yeah. Anybody
I
else?
would like to add a point.
Sure,
Yes.
Dr.
Sorry.
Yeah.
So I'd like to add a point here. I feel like, not I feel, I know for a fact that the patient to doctor ratio varies a lot. Over there, one doctor has to treat about 20, 25 patients in a hospital setting. So the patient to doctor ratio is varied there compared to here. Here, the patients are like per team, there are 10 patients capped. Like in my hospital, I'm working at a hospital here in Chicago. So the max cap you have is like 10 patients per team. And yes, do you have like very like 5, 6 teams in a class or something? But yeah, I would like to say that the patient burden is much more on in India than here, because obviously because of the population and the scarcity of doctors.
That's a very good point, Dr. Yeah. And like, if to that point, I will even add the amount of time we get to spend with each patient is less in my country compared to US. So in US we get more time to interact with the patient, hear their opinions, and give them a better advice, and give them the multiple options, treatment options that we can give. Yeah. We like somebody else wants to answer this question, like if you are prepared, please definitely you can answer all the points that you have in your mind.
I'm sorry, I just read someone's chat. And a great point that would bring up why not stay in India and improve the patient doctor ratio, right? Does anybody have an answer for this? Someone
What if
mentioned it in the chat.
Yeah. So what you can tackle this question, or how you could tackle this question, is like, yes, I would like to first improve my training here so
Mm-hmm.
that I can help people better. So you can, like always twist the answer
Mm-hmm.
and be like, I sorry about that. That's my daughter. So what you can always be like, in order to serve people better in my country or even here, I need to I need to get better training. I need to, like I can't, obviously the better train, what do you call it? So sorry, I'm like distracted because my daughter, I'll type in.
I understood what you're saying. So,
Mm-hmm.
you are trying to say that ultimately, whatever I learn are good things here, and I can implement later some in my home country, something like that. But remember, on the first day, if somebody remember, when I asked this question, if they ask us, let's say, why don't you, would you like to go back to your country, or why don't you go back to your country? If there is a like, patient doctor ratio is like this thing very high. Like if they ask us this kind of question, then yeah, definitely it's a good point. How will we respond if they? But then on the day one, we said, if we are getting training here in US is spending a lot of money on us, so definitely we will try to do our best for the US healthcare system. Like this question comes under how will you contribute to the US healthcare system? But at the same time, if they ask us, why don't you go back to your country if they need you so much? So what would be your answer? Anybody?
I'm like, that's racist and unethical. You can't ask me that question. But I'm sure they're very sensitive, and they won't be asking these kind of questions. They're very sensitive. and it's
I
illegal
know,
to
Mani,
ask these
but
kind of
asking like
questions.
this, the way
Mani.
I put it, that's very in a very refined manner. If then what
Mm-hmm.
you will ask?
I would like, can I answer? Like, what I have in my mind is that if somebody asks me whether I
Sure.
want to go back to my home country, I would just I would not say yes or no. I would say that I would definitely say that in future, after learning after learning new things, new technologies in US, I can just implement that back in my home country by collaborating with different people. So by sitting in US only, I can just collaborate with different people and try to make and try to make that technology available to them.
Mm-hmm.
I would answer that.
Yeah, I want to add
That's a
some.
nice answer. Yeah. Mm-hmm.
Yeah. So you remember the Vasudha Kutumbakam thing? So from that I have derived an answer that for a doctor, boundaries do not matter. All patients, irrespective of country or region, anywhere, our doctor always aspires to improve the healthcare system, irrespective of country. So whatever I will learn here, definitely I'll contribute wherever I will be. I do not know, like for currently where I will be in future, 10 years down the line, but wherever I'll be definitely be a kind of a boon to the mankind, or would be a asset to the mankind. Something we can frame like this. This is what I am thinking.
Yeah, I guess Dr. Indu is right, because what I have heard from
Hope we can
most of,
say that while we are on the hot seat.
hi, can I speak?
Yeah, Suraj, go ahead.
Hi. So I completely agree with Dr. Indu, as she said that so most of the residents with whom I have practiced here for interview questions, so they say that you have to be diplomatic in such kind of answers. So they just want to see that what's your thought process on that. Do you want to go back, or you want to stay in US? So on such kind of question, or whenever they ask you for that, what's the difference between your country's healthcare and United States healthcare? So in such questions, you have to be very diplomatic. Like, you don't have to favor your own country, and you don't have to defend the United States as well. So in the same way, like, will you go back to your country, or you'll stay in United States? So Dr. Indu has given a very good answer, that you have to be diplomatic, that I aspire to serve mankind wherever I am. And you can also add on that so plans are life plans change at every moment. So after completing my residency and getting most out of my residency, I'll strive to serve the mankind wherever I am. And for my long-term plans, I would like to stay in United States. But of course, if there is any unforeseen circumstances in future which I'm not aware of, if such kind of things come up in my life, then of course I'll be ready to serve wherever I have to go. So in this way, I mean, they just want to see that you are ready to serve everywhere, anywhere there is a need for your services, either it's your own home country, or United States, or any other country. So they just want to see the thought process that you are ready to serve the mankind, rather than going back to your country or United States.
That's a very good answer, Dr. Suraj. I would like to add on to this. You can also be like, if they say, oh, why don't you go back or whatever, you can be like, I can get better training here. I can learn more here. I can grow here, because like the opportunities and everything is, very prevalent or whatever. And then you can also add in, like, I can always contribute to, my home country. I can always contribute to the hospitals there, or, healthcare. I mean, um, basically, you get the point. I'm trying to say that you can always contribute back home by telemedicine. That is
Yeah.
a very nice tie up. Like, how we learned how to use telemedicine in COVID, we can be like, oh, I can stay here. Like, in this day and age of internet and, recent AI technologies and stuff, I can sit at home and I can access any part of the world and provide my, my, what do you call it? My services.
Yeah, I mean, yeah. So the whole theme is, the whole interview depends on your diplomatic answers. I'm very being honest with you. This is my second time applying, so I have seen that you have to be very diplomatic in your answers. because they just want to catch you on some point that where they can grill you, and you don't have to give that chance to them. So try to be as diplomatic as you want. So
I agree.
after every answer, they want to backfire with you. Like if you say them, okay, this is the difference between my healthcare and United States healthcare, and something they are gonna just pick it up from those answers, and they're gonna grill you over those questions. That okay, so you told me this, so how will you justify this thing? So in that case, and I guess this platform is a very this is a very great platform where we can discuss our answers, and we can share our thoughts, and we can make very good diplomatic answers so that they don't get a chance to grill us.
Thank you so much, Dr. Suraj, for your insight. Thank you so much. It means a lot for us, like for the who going for the first time. Yeah.
Thank you. I hope we are all
I was
together.
Sorry.
Yeah, you go
I
ahead.
said that I was actually grilled on this question because I'm applying second time as well. So last year I applied very late. So in one of my interview, one of the interviewers was like, tell me about the differences in the healthcare in US and in India. So I said in India we like no I said in US we practice more of evidence-based medicine, and then they were like, oh, what do you use in India? And I'm like, oh, it's like more it's not as much as patient-centered as here in US. They were like, what do you mean by that? Explain me. And I was like, I don't know, like I just came up with something. So yeah, they really like to go down that rabbit hole. They want to like dig deep in the questions. So we want to be like more prepared.
Yeah, especially when they say, what do you mean by that?
Dr. K, but what I feel is that I won't be saying that it's more patient-centered in US. It's even patient-centered in India as well. Like we just cater to, depending on the financial status of the patient, we just alter the treatment accordingly only. Like that's what I feel. It even happens in India as well. But yeah, you could have said that more. It's a practice-based medicine over there. Though to be very honest, I don't know the exact difference between both the things. But yeah, I have to prepare my answer well with the example if they ask me.
May I give you one suggestion?
Go ahead, please go ahead.
So, can we tell them that in India we have a different type of system? Like in a primary care, here you have only one primary care provider that will take care of everything. While in India you have multiple options, and the readiness of availability of physicians you have more compared to here. That's one thing. But in that, the positive about the India, and the same time we are also telling them that in India we don't have the wide spread of insurance to each and every person. The patients have to pay for by themselves for that medications and their procedures and all. While in here, government is sponsoring each and government or any insurance company providing and giving money to the physicians or the system by taking their patients or population. Can we put this way the difference between these two healthcare systems?
Yeah, basically you're telling about family doctor or PCP type of things, right, Dr. Utsav?
Yes.
Yeah, that's a good point actually.
But that what I thought that by comparing, not devaluating other system, by just comparing that there are two differences.
So, Dr. Somebody wants, yeah, Dr. Utsav, like what I feel is that you can just talk about that we have two types of healthcare in India. One is sponsored by the government, that's in the government hospital, it has a high patient load, and other one is a private that's a bit more expensive and it's not accessible to everyone. The private healthcare is good, is very good as it is at par with other healthcare country in the developed countries. But yeah, government one, it's free of cost, and but it's slightly compromised because of the lack of resources in our country. But yeah, you can just frame it that way. Like that is how I can frame my answer. That's a good point to mention. But I would definitely add these things to my point.
Yes, we can add that one. And the other thing that can we start as like, let's say that I'm applying for the second time and I work as a medical officer and during my internship in hospitals. So can we frame that we don't have a chance to give preventive care to the patient in home country as we want? Back in United States, there is a norm, there is screenings for each age appropriate screening for each and every person.
Yeah.
So can
Yeah, I would mention that even like I answered that in my, when I answered, I definitely mentioned that point that it's more very structured and organized in US, but it's lacking in India for sure. Yeah, that's a very good valid point.
We have a
But do you think, excuse me, but how can can we say bad things about our country? Wouldn't this say like we should not pinpoint specific things like lack of equipments or compromised care? All these things, it will affect like that's what we are leaving behind. I don't think I cannot go with this. Like we cannot say compromised care. That's bad for saying like in terms of a country.
Yes, I understand that. I'm not saying that it is a compromise. Just saying that there is no policy about it. Let's say that if I want to do colonoscopy in a 75-year-old male patient in a government hospital in India, it's not going to, he was not going to do that by his own. And it will take toll on him to do this type of, while in US, physician has to just mention with patient, and if patient is ready, then he has no to worry about anything. That's what I'm trying to convey.
Maybe you can say like the patient awareness is very is not good that much in our country, and we should create awareness and try to minimize like the shyness, because colonoscopy people was like, okay, female wants female, male want male, so we cannot say like this, but we can say that by creating awareness, by drawing some pictures, making it very simpler in their own simple language, it will be easier for them to communicate and understand the seriousness of the situation, rather than being said that it's not available and we cannot do it. Yeah, we can say there are financial constraints, because obviously we are in a like India or Pakistan, they are in the developing one of the developing countries, and here in US everybody is working, but in our home country one person work and take care of the whole family, so that he has to think the family first and then himself. That is one of the things we can mention, but I don't think we should say bad things about our country, like compromise care and all that. Yeah, it's the lack of awareness that that I always wanted to create here as well, and then in our home country, like that. That's my point of view.
Yeah, I just want to add. The thing is, like, each country's healthcare has evolved according to the needs of that specific country. So if you take India or something like that, we do TB vaccinations. People in US don't do because the prevalence is low. Same thing with colonoscopy sensing. The carcinoma incidence and prevalence in US is paramount compared to India. So I mean, the government's taking care and government's allocating the resources according to the needs of the population. So you just can't say that in that, right? We're doing a lot of good things. The vaccination drives were more efficient in India, even with if you consider that the infrastructure wasn't that good. The TB screenings are really good in India. So I don't think it's good to compare both the countries and healthcare systems in both countries. We can just put it diplomatically and say that each government and each healthcare system is doing a great job in catering to the patients according to their needs. That's it.
I know that
I
India
agree.
is providing
really answer. Yeah.
I agree. Can I say something, guys?
In just a second, somebody, Dr. Sameer, just raised his hands, a few minutes back. First, let him speak, then we can continue with the discussion.
Yeah, thank you, Ayushman.
Yeah.
So I have one point to add, like which I wanted to discuss since a long time. In US, we see there's a dearth of appointments. You have to wait really, really long weeks. I mean, it's up to like 6 months or even up to 1 year if like your physician is very busy just to get an appointment. But I believe like in countries like our country, you can get access to appointment to like the best of the best doctors like within a day, I believe, for 99% of the doctors. I mean, that is something I believe we can say positively about our country. Like, I mean, that is some real issue which like a lot of Americans face as well.
Yes, what I'm trying to tell in the first place. Thank you, doctor.
Indu, go ahead, please.
All right, I can summarize, like we had a very good discussion, but yeah. So, the policies like Medicare, Medicaid, they also exist in our country, in India, but at different, under different names. One of this is Ayushman Bharat, right? And also there are many others, like I worked in one of the organizations in India. They come under the Ministry of Labor and Employment. And like ESIC, Employee State Insurance in New Delhi, I worked for that. And that's exactly like federally called this FQSC in the US, so we have to educate ourselves more, guys. Like what are if this question we ever asked, then we should know what is in our country. Maybe the levels may be different. Maybe some differences. In many aspects, we have many things in our country. The only thing is we are ignorant about it, maybe, because most of the time we were just studying USMLE, and maybe that's why. And secondly, like many NGOs work at, I worked in an NGO in New Delhi, and I was also working actively during the COVID time. It's a family health system in New Delhi, Hojkhas. So, what I mean to say is just learn more about our system. Also, don't say bluntly that we don't have this, we have this. The thing is, we have more. In our country, we have high population, population, poverty, ignorance, and lack of education. All these things make more burden on our health system. But it doesn't mean we don't have all those things. Here, everything is one more point. Like one of the person says, here in India, we get quick appointment. That's so true. Here we have to wait for days. Like even though the patient-doctor relationship is so less. So we have very good points about India as well. So just we have to collect those data in our mind and then think as a holistic picture. Thank you, guys.
Yeah, the point with evidence and practice base. I just want to ask you guys one question, like how is evidence created? It's from the data, and how is data coming from? It's from the practice. RCTs is nothing but the practice, giving medications and seeing the results. That's what we in India do. There's nothing called practice-based medicine and evidence-based medicine, because both are synonymous. If you contemplate and do a prospective study, what we see in practice is what the evidence is in PubMed, right? So it's like a cycle. We can't just say US practice evidence-based medicine, India practice practice-based medicine. I don't think there's a term called practice-based medicine. So the evidence is coming from the practice, right?
Yes.
Agree.
Yes. I won't make.
I might be wrong, but this is what I'm thinking, because the evidence is from the practice and data which we see from our patients, right?
I am agreeing with.
Just give me 1 second, Dr. Utsav. Like Dr. Om just raised his hand a few minutes back, and he talked, and we'll continue with the discussion so that everybody gets a chance to speak. I'm so sorry to interrupt you. I'm sorry.
No, it's okay.
Please go ahead with your point first.
I'm sorry. Thank you so much for giving me the chance. And all of your points are really good, and I completely the same. The thing that I think everybody should understand is this is definitely one of those questions. I think a lot of people are going to get asked in interviews, and I think in this question, the points are all really good. The most important thing is the language you use. I would recommend. I think this is one of those questions where you have to formulate an answer beforehand. Think carefully, because it's very easy for you to use one phrase or one word that paints either the US system in a negative light or the Indian system in a negative light, and you don't want that, right? If your goal is to be diplomatic, you need to be very, very careful with the words you use. For example, with the patient population, this thing, you can say that we struggle, this thing, it kind of puts that reality of the situation without letting anyone down. Without putting down someone else. If you say compromised healthcare, I think again, that's unnecessarily painting something or someone in a negative light. So I would say most important thing is to be careful about what words you're using and what you say. And you can frame all of your points around all of this, because a lot of points are true and valid. And I completely also agree with the Dr. Indu, what she said regarding knowing more about the system that we work in, because we're all maybe fresh graduates, 2-3 year graduates, whatever. The PDs who have been working, they've been working for tens or 15s of decades, and they would have worked with the Indian system possibly far closer than we also could have, if they are also from India, or if they had collaborations. So saying something without the knowledge, without this thing to back it up, I think it could it could really become problematic very fast. So I think being careful about what you say is the most important thing.
Yeah, that's a very good point. Thank you so much, Dr. Dr. Utsav, please, and Dr. Suresh, please go ahead. Yeah.
Yeah, so I would say, okay, Utsav, you want to go first, or?
You can go first. I will do next.
Right. So I would basically say that this question is basically wants to know that how is your system different from United States health system. They do not want to know that what is bad in your health system. They just want to know the structure of the health system of India, Pakistan, Bangladesh, or Nepal, and they want to see that you understand that system, and you know the United States health system as well. So as I have seen here that so I would just share some points which I have observed here during the rotations. I've seen that they have during the residency, they have this 6+1 block or 6+2 block. That is their healthcare system. Like during residency, you have to go six weeks inpatient, and then 1 week for continuity clinics, for 1 week, or maybe for 2 weeks, you have to go outpatient. You can just raise this point that here during residency, you have this schedule, but in India, we have complete inpatient rotations, and then you go for 1 month, or you have weekly clinics with inpatient rotations. This is one of the things that you can raise. So just don't say bad things about United Care health system or the Indian health system. Just say positive things about both of the systems. So like evidence-based medicine, you said for United States health system. For India, you can say that anything that is good, like you are seeing more patients, or anything that is positive. So you can just say 4 positive points of Indian health system and 4 positive points of United States health system. Don't bring anything negative in between that. They just want to know the structure, that how is your structure in India and how is your structure here. And yes, one thing was also good that you can say that what the other difference you can say that we already discussed about medicines, that medicines are readily available. Even the antibiotics are readily available in back home our country, but antibiotics are not available here. And the second point you can talk about is patient awareness. So these things does not put a question on the healthcare system. Like medicines are readily available, and patient awareness. These both things you can talk about in this answer, because they don't put a question on the healthcare system of your country. So just give them such kind of diplomatic answers so they don't backfire you on, oh, okay, so your healthcare system has this negative thing. So you don't want to give any answer like that. And basically, we have to formulate our answer very comprehensive and concise. They do not want to listen so many things. They just want to look at you that what do you have in your mind. So just put your answer in, complete your answer in 40 seconds. 40 to 45 seconds, you should be done with that answer. Any answer you're giving, 40 to 45 seconds, you should be done with your answer. If you if you give them a lengthy answer around 1 minute or more than a minute, they'll get bored and they will ask another question. So before they ask another question, you should complete your answer in 40 to 45 seconds. So they should be interested to ask more questions rather than just listening to one answer.
I agree with what Dr. Surya just mentioned, but I would also like to add one more thing on the point he previously mentioned, that the healthcare differs here and in India in a way that in India we have more options rather than the modern medicine or allopathy. We have homeopathy, we have Ayurveda, we have Unani medicine, and we have so many parallel streams of medicine over there. So I think that'll make a very good point. And here it's just, yes, we have upcoming homeopathy here in US, but most of the healthcare is modern medicine or allopathy.
Very good point, Dr. K. Yeah, even I was thinking about that. But yeah, I think like I have to search like chiropractors and every alternate forms of medicines are in US as well. Yeah, but that's a good point. Like we can research and put it into our answer. And as Dr. Suraj said, that we need to be diplomatic. So suppose if I am giving a comparison and shows my country in a bad light, slightly a bad light, I can just simply add a point that definitely the policymakers and the government of India are taking measures to improve it. But yeah, it will take some time. But yeah, the things are definitely improving over a period of time, so that it doesn't look that I'm trying to put down my country. That I would do to my answer.
Ayushman, this chiropractors, acupuncture, these local medicines, alternative medicines have evolved in all countries, not only India. Every country, US, Brazil, Canada, everybody has their local things.
Yeah.
So just saying, yeah, they do have like many, we don't know about them.
Yeah, that is why I am saying that for my answer, I definitely have to like read something about that. But yeah, that's a very good point that we can bring about, that we have a prevalence of Ayurveda, homeopathy. Then we have this BUMS, like I don't know what Unani medicines were very prevalent in our country. But yeah, about US,
That's Unani.
Yeah, that's a good point. That's a very good. Hey, Dr. Utsav, please go ahead.
One thing is, here in US, it's not as prevalent and mainstream as it is in India. In India, if something goes off, even like financial burden, for example, if the patient thinks the medicines or the healthcare is too expensive here in India, in India, then what they do is they opt for other options like homeopathy. It's way cheaper. It's less invasive. It's like minimally invasive. Now they have approved for invasive procedures as well. So we can say like it's minimally invasive rather than modern medicine, like undergoing surgeries and stuff. So that's why a lot of people, for financial burdens or like whatever preferences, they opt for other streams of medicine or healthcare.
Guys, on day 1 or 2, we discussed about this alternative medicines, but since they are not evidence-based, since they are not, they all methods like Tai Chi, acupuncture, these all other methods in different countries. China has a lot of things, but they don't. Some of the things like our Unani and but we don't have evidence-based in them, though we practice in India. But don't you think we don't have research? All those paper things, research things, documentation, proper things. It's not organized, isn't it? That's why on day 1 we discuss, we won't be like boasting so much about these alternative things in India.
No, we're just highlighting the differences and why people are shying away from modern medicine. Yes, of course, modern medicine or allopathy, we have evidence-based medicine. That is why it is way prevalent in any part of the world, let alone India.
But because remember, even those Ayurveda or Unani people at the time of emergency, they just rush to hospitals, the allopathy, right?
Yes, that is why allopathy is much more prevalent and easily accessible in any part of the world, right? People won't run to homeopathy if they have a critical or emergency situation. They will definitely run to a hospital.
Yeah, that's a good point. Yeah. But yeah, we are just highlighting our point. Like if somebody asks about difference, we can tell that a lot of alternative medicines are also practiced in India. Like we are not boasting about it. We're not saying good things about that. Definitely, we are practice allopathy only. But yes, that's an important point that we can mention during this.
So, I will, in short, in one sentence, I will say like this, that besides allopathy, Indians have other alternative methods, like you must have heard about allopathy, Ayurveda, Unani, so that some of the, long-term diseases, like, the chronic diseases in which patients also need some kind of palliation, some kind of, comfort things. So like acupuncture and all these things, they give them comfort or palliative effect as well, apart from allopathy, the curative thing. So so that helps the patients. That's what I believe. I'm not saying that they are curative or they are evidence-based, nothing. I'm just saying that they are also there, which helps, only helps, not the curative part.
So yeah, so Dr. Utsav, please, you can just go ahead. You have raised your hand way back, so I'm sorry. You can just go ahead with your points.
Dr. Gupta. So my point is just, we are fortunate that we train in our home countries and they are very good. But right now our focus is on not giving a point and this one is bad and this one. Right now our point is to give answer to that person who is asking us question and who is evaluating not our home country, because many program director and everyone get know that person who came from Asian countries and work hard here. So then all these things, but our they are judging that we are able to evaluate the different system without making any system bad. So I believe that we should stick that particular thing, that how we going to answer this question rather than focusing on other. I agree and I respect everyone's opinion and input, but that's what I feel, because that will be there is the way that we can be productive and cover as much as question in a short term. That's my point is. Thank you for letting me.
Thank you so much, Dr. Utsav. Like Dr. Stuti, you want to add something? Please go ahead. Anybody else wants to add something to this? Like we still have 12 minutes to go before the meeting. Like it's a recurring meeting, it will continue to happen. But yeah, anybody wants to add something? Like we cover two questions today. First one is the difference between the home country and the US healthcare system. And the second one was the advancement in the healthcare system across the globe. Right. So I think like we are done with the maximum number of questions we have covered in these, the meets we have every day. So yeah, so like after 10th, we can just start with the mock interviews. Like somebody can get PD and the other person can get interviewed. Like if you're comfortable, like whosoever is comfortable in doing that, and we can just get some points, and like we can just get new points from new perspectives from their interviews, and it will even we'll get to practice the interviews with each other as well. Like, is that okay? Like we can just think about that as well.
Yeah, I think that'll be helpful a lot.
Like we can just have 10 to 15 minutes of mock interview. Like two people can have, one can be the PD and other one can be the other one can get interviewed, and then for 5 minutes we can just have some discussion. Then we, like it's a single day in 1.5 hours, we can just get covered, like 4 people can get the mock interview done. So because it's a free platform, and even you can share more links where more people can practice, and that's how we'll be able to cover more and more people, and have our fair share of practice, and everybody will get an equal chance.
Yeah, I guess that's a great idea. So, I mean, we can even give feedback as well to all the interviewers, like that how they can formulate their answers in a better way. So when 90 people are listening, so there are like 90 minds are working on one answer, and we can help each candidate to formulate their answer in a better way. What choice of words can be used there? Because your interview mainly depends on two things: that how diplomatic you are and how concise and comprehensive you are. So for comprehensive and concise answer, you should have a very good choice of words. Even if two persons are giving the same answer, the program director will remember the one person who has chosen a very good choice of words. So of course, because if I'm saying that I belong to this, or I have worked in back home country for 3 years, but the other one tell that, yeah, I have worked for 3 years, and he explained some more things, and he chooses a very good choice of words, then of course program director is going to remember him over me. So this is the thing that we can advise each other during this mock sessions. And there's one more question asked. I don't know if we can add one question in 10 minutes, like if we can discuss on that.
Yeah, Dr. Suraj, just before that, somebody asked in the chat box, like for how much time is one interview? Like since you're applying for the second time, can you just talk about that? Like how is your interview experience overall?
Sure. So it varies program to program. So last time I had 5 interviews. So most of the programs have they have 2 panelists, and program. So at one program they gave me 20 minutes. Like both the interviewers were taking 20 minutes. And at one program they had 3 panelists who gave 15 minutes for each, like 45 minutes. And at another program there was just one interviewer who was taking an interview. So whenever there is one person who's taking an interview, he will take around half an hour to 40 minutes. So it varies program to program. And you have to formulate your answers also like that. For example, if you see that your interview is being taken by 3 persons, then most probably each of your interviewers will be taking 15 to 20 minutes. So if you have 15 to 20 minutes with that person, you wanna improve your time with him. So you have to give very concise answers to that person, because in 15 to 20 minutes, you want that he should ask you more questions to know more about your personality. So in that case, you don't want to go for the lengthy answers. For example, if he asks you, tell me about yourself, then you can just finish your tell me about yourself in 90 seconds. But but on the other hand, on the other side, if you see that your interview is being taken only by one person, only program director is going to take your interview, nobody else, then of course you have 40 to 45 minutes, and you do not want that your interview should be finished earlier, like in 15 minutes. In that case, you have to give very good answers, and you have to make stories in every answer. So if they're asking about tell me about yourself, then you have to tell me about yourself in 3 to 4 minutes, and it should include very interesting stories that program director should get more interest in you, and he should ask more questions from that. So this is what I learned from last cycle, that I should have at least 2 sets of answers for each interview. Like if interview is going to be for 40 minutes, then I should have very detailed answers, including one example or any story with each answer. If the interview is going to be short for 15 minutes with each interviewer, then I should have those concise answers, like not more than 60 seconds. I have to try to give all my answers in 45 seconds. Only tell me about yourself can exceed to 1.5 minutes. That's it. So this is the thing that I learned from last cycle. And yeah, so you'll see that most of the programs have like 2 panelists or 3 panelists, and each will be like 20 minutes, 15 minutes, 20 minutes. Only 1 or 2 programs were there last time who were interviewing like only one person and one interviewer, and they were taking interview for 45 minutes. So there you have to be very clever that how you want to utilize those 45 minutes, and you have to give your best in those 45 minutes.
Thank you so much. That's very insightful. Yeah. So yeah. So before, like, we are just 6 minutes to end. Like this, actually, you can join this like anytime, and you can talk because it's a recurring link. So yeah, tomorrow I am not available. So but the link is available. You can just meet at like whatever time you want and have a discussion. But tomorrow I am like a little bit busy, and plus getting the sessions done every day, it's quite hectic for me. So I just want to break for one day. So tomorrow I won't be available, but yeah, the link is available. I'll share the link again tomorrow, like after the session only, and you can just join the link at 9 only, like whatever time suits you, because it's a recurring link and it's available throughout the day.
Sure, yeah, I get that's great. And I mean, we can take advice, or we can make a poll for on the group that what most of the majority of the people want, that they tomorrow want to discuss some more questions, or we want to start with the mock interviews.
Like we might have missed some questions, right? Like why voluntary programs, or some other questions like what animal would you relate to, or some more questions like there are some more questions we have.
Like
we might
the most memorable patient experience you have.
Yeah, most memorable patient encounter.
Any conflict with the patient. And last time, one more question was being asked from most of the programs, that they asked that define yourself in one word that I should remember you while ranking. So that was a very challenging question. So you have to remember, like there should be one word which defines all your qualities, whatever you have told in tell me about yourself and your strengths. So you have to dig out any word that defines yourself in one word, and they should remember that. And apart from that, sometimes they ask that what is your favorite animal and why so. So sometimes they want to ask that question as well. And apart from that, yeah, I mean, they just want to know some favorite sports. Sometimes they ask about favorite sports. Why so? So in every answer, they just want to know their thought process, that you're a teamwork. You like to work in team, and kind of your leadership qualities. They want to assess those things in every answer most of the time.
Even the favorite movie you have, like like somebody, I was just watching the interview on the YouTube of Malki Saad and one girl, and that was one of the questions, like, what's your favorite movie? And from there, they can just ask your opinion. Yeah, that's been a very good questions that you talked about. I just
One of my senior also told me this question like, do you know how to arrange Rubik's Cube? When the interview was going on so seriously, and suddenly one of the interviewer asked her like, do you know how to arrange Rubik's Cube? Suddenly.
Oh.
So these are the questions they have been asking us.
And everybody say that try to read a good book. So sometimes the interviewer asks you that what is the last book you have read? So try to study a good book. If you have already done that, good. Otherwise, they say that during the interview you should study a good book, maybe philosophical or anything that you like. But they usually sometimes the programs ask that what is the last book you have read. And for hobbies, I would say that last time I've experienced, I mean, while doing the mock interviews with some of the guys, so they told me that they put a fake hobby, like just to impress the program. Like somebody just put like chess is my hobby. I like to play chess, and the program director was also like a fan of playing chess, and he asked him that, okay, so I mean, he did not go into the much details, but he just asked the basics of the chess, and the guy was trapped because he didn't know. He just put it as a hobby just to show off, like that his CV should stand out. But when the program director asked him, then he was like, "Oh, no, no, it's not my hobby. I just started playing it, so I don't know much about the chess." So you have to be ready for everything. If you have written anything in the CV, like you should have a valid answer for that. You should learn your CV and personal statement by heart. They can ask anything from that, from any even single word. If you have written, they can ask a question from that why you have written this thing. So you should learn your CV and your personal statement by heart.
I totally agree. I was asked one of the question. On my CV, I mentioned my hobbies were traveling. So one of the interviewers last cycle, I mean, my interviews were not within the season. I had 3 interviews off cycle, like after the math season was ended. So they were kind of long. They were like 5-6 hours. So one of the interviewer asked me, he was like, "Oh, I see you like traveling. Tell me about what countries you went to, like, you traveled to." So I mentioned a couple of countries where I went. So he goes, "Oh, okay. Tell me about this country. Where did you go in this country? What did you see there? Like what are the tourist spots? What are the destinations?" And he said that what are the foods you see there? So obviously, because I had traveled to that country, I knew everything about that in and out. So I mentioned like, "Oh, I went there. I saw this." And then after asking me all those questions, he was like, "Oh, that was my favorite spot. I went there too." And then he goes, "Oh, that was the most beautiful city out of all the cities they had, and this and that." So they will definitely pick one thing and go deep into it. I wasn't expecting that. It came out of nowhere. But of course, like, they want to see if everything in your CV is genuine or not. And
Yeah,
another
I
thing is
totally
you
agree.
can definitely find a common ground. So, you make an instant connection when you find that common ground.
Exactly. I totally agree with Dr. K. Like, like if you have got even 5 to 8 interviews, so one of the I from those 5 to 8 interviews, in at least one of the in any of one of the interviews should be you'll come across one of the program directors or any person who would have the mutual interest like you, and they will of course go in detail for all those things. That's why I'm saying that just learn your CV by heart. So if you have written anything, even if you have written anything fake just to stand out your CV, go to the details of that thing. So if during the interview someone who has the same interest as you have written in your CV, he will definitely go in detail of that thing. People write traveling, people write hiking, people write horse riding. So some of the person definitely is going to have the same hobby as you have written, and then he's going to ask everything about that.
We're done
Okay,
for
so
like, should we close the meeting? It's already like 10:30. You guys can stay here like whatever you want. So tomorrow I won't be there, but I'll share the link and you can just discuss new questions. or even the previous questions you want to do, you're free to do that, and I'll join you guys on Monday. So from like after 10th onwards, we can just have the mock interviews. Like we can just prepare a little bit in advance our answers and everything, and practice in the mock interview. Like 3 to 4 people can just per session, like everybody can just talk, and it will be like a great learning for all of us, and we can just get a required input from everyone. Yeah.
Yes. Yeah, I guess you're right.
I had a question for Dr. Kumar.
Sure.
Yeah, I wanted to ask, like, as you mentioned that for these 15-minute session interviews, so if you are asked the same question by 2 of the interviewers, like, did you give the same
Recording
answer?
stopped.
Yes.
Like maybe tell me about a patient encounter that you remember. So would you give the same answer, or do you need to give a different answer?
You can most of the time the thing is that they don't ask the same question. So whenever there are 3 panelists, so they divide their answers that who's going to ask what thing. So one of the interview would be asking you the behavioral questions only, like tell me a conflict with your colleague, tell me an interesting patient, or such kind of behavioral questions. Or he might give you a scenario that you are in ICU and such thing happened with the patient, and what will you do now? So one of the interviewer might ask such type of questions. Other one will be just assessing your personality, like strength, weakness, tell me about yourself. And the third one, he would just ask 1 or 2 questions randomly, and then he'll be saying, okay, now let's talk about the general things. So all the interviewers will be asking the different questions. But at any time, if you're asked like same question from both of the panelists, then you can give the same answers. But I would say that at least keep 2 conflict scenarios and 2 interesting patients. So anytime, I mean, if you never know, so at least you should have examples and stories of like 2 stories you should have for each of the questions, or 2 examples you should have for each of the questions. And for strength and weakness, they say that you should have 5 strength and 5 weakness with the stories in your mind, like with examples. So most of the programs, they usually ask like tell me 3 weakness or 3 strength, but people say that you should have at least 5 in your mind.
Okay, yeah, that's very good. And like for if there are 3 interviewers, so do each of them give you time to ask questions to them in the end, or just the last interviewer?
No. Everyone will give you the time to ask. Like last 2 minutes are for the questions. So they give you a chance that if you have any questions for me, then you can ask. So everyone will give you a chance to ask the question separately.
That's great. And is there a structure to the interview? Like first of all, they will ask you about yourself, and then try to assess your strength and weaknesses you mentioned, and lastly the behavioral questions. So that is the structure for the majority of the interviews.
There's no structure actually. You drive your own interview. Whatever you say and tell me about yourself, that's gonna drive your interview. If you say anything interesting and tell me about yourself, your whole interview can go on that particular thing. And he may not get a chance to ask the other questions, because if he likes anything in your tell me about yourself, he can talk about that for 15 minutes only on one particular thing. So there's never a particular structure for these questions.
And is that a good thing or a bad thing? Like if 15 minutes go on about one topic
It's a
only?
good thing. I mean, if the interviewer has a mutual interest, like you said, for example, in Tell Me About Yourself, you told about a very good story that interviewer is taking interest in, and he want to talk about that thing for 15 minutes. That's a good thing. That means he want to know more about you from that perspective, and that's a great thing, I guess.
Okay, thank you so much for the answers.
No problem. And it's for everyone. I mean, whoever is listening. So you just make your tell me about yourself very crispy and interesting, so that whosoever is listening to tell me about yourself, uh, so he should ask you questions from that.
അപ്പം നീ അത്രയും തന്നെ വേണ്ടി വരില്ല. എന്നാലും ഓക്കെ 10 വർഷം അവിടെ കിടന്നിട്ട് നീ ഒരു കാര്യം ചെയ്തോളുക. എന്റെ അക്കൗണ്ടിൽ നിന്ന് ഒരു 30,000 റിയാല് നിന്റെ അക്കൗണ്ടിലോട്ട് മാറ്റിയിട്ട് ആ പൈസ
Can someone mute him, please?
ഇനിയിപ്പം പലർക്കും
Yeah. So before he gave out his bank account and details, we don't want that to happen. So that's why it was important. Thank you.
Yeah.
Dr. Suraj,
Yes.
can I ask you a question? For your weaknesses, like, could you tell us like one answer, like specifically, like if they ask you about your weakness, then how would you answer it?
Mhm. So you can say that, of
Thank
course,
you.
like most of the time you have to say that that's a very good question, and like you can start your answer like that's an interesting question, that's a very good question, that's a great question. So most of the time you have to start your answers with that, and then you can just tell about your weakness, that or you can just say that we are all human beings, and nobody's perfect, and everybody has any weakness in their personality. And my what I have assessed from my personal experiences, my weakness is XYZ, whatever your weakness is. And then you can say that through the time I have been trying to overcome my weakness, whatever you have been doing to overcome that weakness. For example, if you say that you are a shy person, okay, or if you don't speak much, if you're an introvert person, then you won't say that you're introvert, or you won't say that public speaking is your weakness. So you'll use a very good choice of word. You will say that I'm a shy person, and but I realized that in the field of medicine, I have to be proactive, and I have to talk to a lot of people. So I try to overcome that via public speaking. I joined declamation clubs or debate clubs, and other public speaking clubs. And throughout the time, I have been striving, and now I have overcome my this weakness. Now I have a YouTube channel where I talk to different people, or maybe you can say that. Um, I have been mentoring people, so this is how I overcome my weakness of my it's just like you're just telling that your public speaking was your weakness, but you did not use the word public speaking because that looks odd. So you use you chose a very good word, that was shyness, and you overcome your shyness via public speaking, debating, and opening YouTube channels. Initially, you can say that I had a very hard time talking to people, but with the time, I really enjoyed talking to people, and this is how I overcome my shyness. It'll just be like 30 to 40 seconds. That's it.
Oh, thank you, doctor.
So I guess till 10th, yeah, I guess Dr. Gupta said that from 10th of October we can have the mock interview. So it's 7th, 8th, and 9th. Okay, 2 days more, and we can discuss more questions on the same platform, and then we can start the mock interviews from 10th October. So in the
Yeah,
Dr.
meantime,
Suraj?
I want to
yes.
say something. Many of us joined on day 2 or day 3, like not from the first day. So some of us missed those questions, the initial basic, whatever questions we missed, we can cover them tomorrow when Ayushman may not be with us, but we can discuss about them. Sounds good? What do you say?
I guess I agree with Indu. So in 2 days, we should help each other to formulate our answers very well, so so that we can give very good mock interviews, and we can have very good feedback from everyone, that how like what else we can do to formulate our answer in a very comprehensive and concise manner.
Dr. Indu, so the sessions which were not recorded previously, I think we can do uh, like similar session tomorrow and record it.
Exactly, that's the plan. Tomorrow also will follow the same way. What Ayushman said, he may not be there, but we all are there. So he will send the link and we'll continue the same way. Sounds good?
Sounds good. Sounds good.
All right.
I had a doubt actually. So can we open this link throughout the day, like the same link whenever we want to? So if people are free during the afternoon or whatever time they like, people can discuss, and then all of us will obviously meet at 9 o'clock.
Ayushman, good point. Ishan, good point. What we can do this. We'll put these questions on WhatsApp group after finishing this session. So Ayushman will reply, or BJ, whoever, they will reply us whatever our confusions.
Oh, okay. I mean, can we open the link, or
I think so.
can
We
we
can,
not?
but still I'm not 100% sure. So I'll ask Ayushman again once, in the WhatsApp group or directly, whatever works for us, and then I'll update if I get an answer. All right.
Thank you. Thank you.